In New York State, the idea of opening back up because it's safer now to open up in a way that it wasn't before, that's complicated, as maybe it should be. In terms of the way the state is approaching it, the state is divided into 10 different regions. So like New York City is just one of the 10 regions. And then the state government, Governor Andrew Cuomo, has set 7 different metrics that all have to be met in each of the 10 districts if any of those districts wants to start opening up. So you need a 14-day decline in hospitalizations, a 14-day decline in deaths. Your per capita hospitalizations have to be under a certain threshold for a 3-day rolling average. 30% of your hospital beds need to be open and available, 30% of your ICU beds as well. You have to be testing a certain percentage of your population every day. You need to have contact tracers in place and working a certain number per capita based on your infection rate. Of the 10 regions in New York State, 5 regions in the state have now hit each of those 7 benchmarks, and they are going to be starting the opening process just a few hours from now, a minute after midnight. Tomorrow is the first day that 5 of the 10 regions in New York can reopen. 5 other regions in the state haven't met all 7 of those benchmarks, and so they are not opening yet at all. Which sounds complicated, right? 10 different regions, 7 different benchmarks. You have to meet them all. 5 of the 10 are meeting them, so it's complicated, right? Yeah, it's complicated. It makes sense that it's complicated. This is a new virus that we don't know any freaking thing about, except that it spreads like wildfire and kills humans in huge numbers by mysterious means. It ought to be complicated. If anybody tells you this is simple, they're either not doing the work or they're lying. I mean, you ought to have a lot of boxes to check and things that you need to have in place and stuff that you need to triple check before you start telling people it's now okay to do things that are inevitably going to expose people to each other more and produce more spread of infection. And so, yeah, if you are New York and you've had 20,000 people dead already, right? But your curve looks like this. Your curve is coming back down to where it started. Well, it is understandable that you are starting to at least cautiously think about where you might want to be able to open up in that state, in some parts of the state, with caution, with 7 different benchmarks you need to hit, right, given how many cases that you've had. But, if you're Alabama or Arizona and your curves, such as they are, look like this, right? They look like Cameron Diaz's bangs in There's Something About Mary. I mean, if you're Mississippi or Texas and your curves look like this, right? You're not New York. Look what you're doing. Look where you are in your curve. Or let's say you are South Dakota or you're Wisconsin and your curves look like this. Yeah, you're not in the same place that New York is in. Yeah, opening up right now, if you're opening up right now, that is something that is not being driven by the data. That is not something that's being driven by the reality of where you are in your epidemic. If you're opening up and your curves look like Wisconsin and South Dakota, there is something else at work. I mean, doing it in a science-based way is hard. So is getting the government of the United States of America to help with that in any way, and in some states, getting them to stop hurting. The Associated Press has had this blistering series of reports over the past couple of weeks about the CDC preparing expert science-based guidance on how to reopen stuff safely. Right, practical step-by-step decision tree type guidance that you can use to reopen safely or to make decisions about when you can reopen safely. If you run a school or a childcare facility or a camp or a religious institution or college or a restaurant or a bar or a retail business or an office, the CDC has been developing practical science-guided advice, which, as the AP reported, the White House has kiboshed, right? The White House had kiboshed this advice from being released to the public, prevented the CDC from getting that expert advice out to the American people, even as governors around the country kept announcing reopenings in all sorts of states, right? Without any practical science-based advice on how to do it safely. Meanwhile, the CDC has practical science-based advice for how to do this stuff safely, and the White House says, no, you can't let it out. Well, the AP has been reporting on that for a couple of weeks. And now Turns out it's amazing what ultimately happens when those guidelines the CDC has been working on get leaked to the press. The Associated Press publishes them. The administration has to start answering hard questions every single day about where those guidelines are, why they haven't been finalized, when are they coming out, why have you blocked them from coming out? We could really use this practical information. I mean, turns out it's amazing what that kind of pressure will do. Because after reporting on this for a couple of weeks, tonight, behold, here they are. Pressure works. These guidelines from CDC have been magically unbottlenecked as of tonight. After 2 weeks of excellent Associated Press reporting and whoever their blessed sources were who leaked the earlier draft of this guidance so we, the American people, would know the CDC was working on this thing and that we should get it. With all the pressure that came from that reporting, we've now got these guidelines as of tonight, and they are helpful. I mean, if you run a restaurant or a bar, here's the decision tree format for how to decide if you can reopen safely and how to do so safely. You know, you've seen all those vague assertions and admonitions about careful cleaning and disinfecting of workplaces and other places where people might come together after reopening. Well, be vague no more. Here's 9 pages from the CDC on what it actually means when they say cleaning and disinfecting. 9 pages, guidance for cleaning and disinfecting. Not sure exactly what might need to be cleaned and disinfected? Well, here's a 2-page decision tree to walk you through what needs cleaning and how in any workplace that's reopening. This is good. This is helpful. This stuff would have been handy a long time ago, particularly when Republican governors started willy-nilly telling people to open without giving them any advice on how to do so safely. I mean, had it not been for the AP leaning on this story with a crowbar, who knows if this guidance to schools and daycares and camps and restaurants and all these other, who knows if this guidance would have ever seen the light of day. The AP's reporting was, in fact, that the CDC was literally told by the Trump administration that this guidance would not see the light of day. But now, because of pressure and because of public reporting, it has. That is the power of the free press. That is the power, honestly, of people working inside government who know something's supposed to happen and who let it leak to a reporter, let it leak to the press. Because the public needs to know about it, because the government needs pressure. May I also take this moment to mention that if you know of something that needs to see the light of day, you might want to send it to me, www.sendittorachel.com. We look at every single thing you send us. We follow up every single thing we can. But kudos to the AP for leaning like heck on that story, which I 100% believe is the only reason those CDC guidelines, which are really useful, have finally been pried loose from a Trump administration that did not want to let them become public. That said, in general, the bad decision-making around the country when it comes to this epidemic and the consequences of bad decision-making around the country do just keep mounting day by day. Big picture, things aren't getting better. Texas, for example, continues to aggressively open itself back up, even as the epidemic in Texas appears to be taken off like a rocket ship. Critical coverage from the Texas Tribune caused a major JBS meatpacking plant in the Texas Panhandle to just change its mind overnight last night as to whether or not it would allow testing of its workers as that plant stays open despite what appears to be a significant outbreak there. So again, that's another instance of the free press making something get better. In this case, in the state of Texas. Texas had just had its worst one-day death toll yet, and it just had 5 straight days of over 1,000 new cases a day, but Texas is still just ripping through, opening up as fast as they can. In places like Sioux Falls, South Dakota, Minnehaha County in South Dakota, they've got over 3,000 cases there now. In Woodbury County, Iowa, which is Sioux City, Iowa, they've got over 2,000 cases in that county. Just over the state line from Sioux City in Dakota County, Nebraska, they're closing in on 1,500 cases there as of today, which is astonishing given that there are only 20,000 people in Dakota County. There's 20,000 people in the county. They're going to be at 2,000 cases of coronavirus there soon. It's Dakota County, Nebraska, which has a large meatpacking plant. In Little Morgan County, Colorado, population less than 30,000. This week, they overtopped their morgue supply, filled up the mortuaries in the county and all the extra storage units for extra bodies, and now they've brought in a refrigerator truck to handle the bodies that they otherwise have nothing to do with. They parked the refrigerator truck to be a temporary morgue out behind the sheriff's office in Fort Morgan, Colorado. They've got a Cargill meatpacking plant there. In McKinley County, New Mexico, the one hospital there in Gallup is fairly overwhelmed. These are doctors from that hospital protesting outside at the lack of staffing, the lack of protection, the lack of help amid a huge surge in patients. At that hospital, they had one pulmonologist on staff, one doctor who specializes in respiratory stuff. That one pulmonologist just quit after working 6 straight weeks without a break. So the doctors and nurses there are protesting for help. In McKinley County in Gallup, New Mexico, they're adjacent there to the Navajo Nation. Navajo Nation has a per capita death rate from coronavirus that is higher than almost every other state in the country. Doctors Without Borders, the Nobel Prize-winning international relief organization, has now sent in a team to try to help the Navajo Nation, which is great of Doctors Without Borders, and they freaking know what they're doing, but it is astonishing and is distressing that that's what's needed in the United States of America. Right? The Indian Health Service is part of the federal government. It's under HHS and Secretary Alex Azar. Right now, they're getting bailed out by international humanitarian groups that usually do this stuff in third world countries because our government can't do it. The federal government also, I should mention, appears to be the problem in the other major outbreak that is now afflicting the great state of New Mexico. The state's governor, Michelle Lujan Grisham, is rip-roaring mad now about 65 cases that have just emerged at a private detention center that holds people in Otero County, New Mexico. This is a detention center that contracts with the federal government. They hold people for ICE, for Immigration and Customs Enforcement, and for the U.S. Marshals. They've just had 65 cases there. Governor Lujan Grisham is now demanding that those federal facilities start widespread testing. And she's basically demanding that they get their act together. Quote, they didn't take any of our standards for how you visit, how you're training staff, what you do for infection control, mandating that guards and staff have masks. And this is a huge failure in the federal system, she said. They weren't doing it. They are very difficult to work with in this context. It is a total violation. You know, once you've got 65 cases in those facilities, those 65 cases are not going to contain themselves to that facility. People who work there leave that facility and go home to their families at the end of every shift. Once you've got 65 cases in a facility in that county, you're going to have an outbreak in that county. That's how it works. And, you know, it is one thing to have an absent or lame federal response to an epidemic. It's another thing when the federal government is actually the entity that is itself screwing up and not following the rules and not following infection control procedures. And therefore, they are who is causing big outbreaks in your state. But that's what's happening in New Mexico now. That's why that governor is so mad. And you know, coast to coast, tip to tail, the federal response just continues to be absolutely terrible. It's really not getting any better. I mean, today, for some reason, the person at the Pentagon in charge of procuring equipment under the Defense Production Act, they just fired her. Without explanation. Sure, seems like a good time. Does it have anything to do with the fact that they just installed somebody at the Pentagon to check high-level officials there for loyalty to President Trump? Today in Congress, a former senior vaccine development official, the head of BARDA, basically pulled all the fire alarms on how bad the federal response has been thus far, but importantly, how bad it still is now.
We do not still have enough personal protective equipment to manage our healthcare workers and protect them from influenza and COVID-19. We still do not have the supply chains ramped up for the drugs and vaccines, and we still don't have plans in place on how we distribute those drugs and vaccines, and we still do not have a comprehensive testing strategy so Americans know which tests do what to do with that information, and we know how to find this virus and trap it and kill it. So there's a lot of work we still have to do.
We keep being told by the White House that we've heard very soon, quick numbers, a matter of months for that vaccine to be developed. This is your area of expertise. You are a top immunologist in the world. Was there any scientific basis to suggest in March that we'll have a vaccine in the next few months?
There's a lot of optimism. There's a lot of hope. but that doesn't make a vaccine. There's a lot of work that needs to be done to make a
Will
vaccine.
we be able to vaccinate people in the next few months?
It's very unlikely.
In your whistleblower filing, you discuss a February 7th meeting of the department leadership group at which you urged the department to focus on securing N95 masks. Can you describe what happened at that meeting?
They informed me that they did not believe there was a critical urgency to procure masks. They conducted some surveys, talked to a few hospitals and some companies, and they didn't yet see a critical shortage. And I indicated that we know there will be a critical shortage of these supplies. We need to do something to ramp up production. They indicated if we notice there is a shortage that we will simply change the CDC guidelines to better inform people who should not be wearing those masks, so that would save those masks for our healthcare workers. My response was, I cannot believe you can sit and say that with a straight face. That was absurd.
It was absurd. It's Dr. Rick Bright, top vaccine development official who was demoted recently by the Trump administration. He has filed this whistleblower complaint because he wants his job back at HHS. There's no sign the Trump administration is going to give it to him. I think the thing that's most important here, though, in terms of what Bright is blowing the whistle on, is what we know now, not just about how screwed up things were for the past 3 months when this virus was spreading unabated in our country to the point where it's now infected way more than 1 million of us and has now killed more than 85,000 Americans. The important thing is not just what went wrong that allowed us to grow the largest epidemic on Earth by far. The hard thing is that we're still screwed up. We're not getting better at the federal level. And honestly, the states that are blindly following the federal government's peripatetic lead, they're finding themselves marooned in this epidemic now without a way out of it. Let me just give you one other example on this point. You might remember in the news, we covered it here a few days ago, that the Trump administration had finally recommended that all nursing home staff and residents should be tested for COVID-19. Finally. After more than 25,000 Americans died in nursing homes in like 2 months, finally they decided they would recommend testing for everybody in nursing homes. Great. NBC News reports today that the federal government has done absolutely nothing since making that recommendation. They've done absolutely nothing to make it possible for nursing homes to do that testing. They're just saying, hey, test. No money to do it, no means to do it. They're just suggesting now 2 months in, hey, we think you should do this. And that's what counts as the federal government response to nursing homes. Quote, asked whether the agency would pay for universal testing in nursing homes, CMS, the federal agency responsible for nursing homes, didn't provide a direct response. In New York State, Governor Andrew Cuomo has just told nursing homes there that he will strip their licenses unless they test their employees twice a week from here on out, twice a week, every week. But then he sent out 110,000 testing kits to New York nursing homes, which isn't enough. But it at least recognizes that those two things should be linked, right? That if you're going to mandate testing, you also have to give people a way to do the testing. You also have to at least give them a start at it. Because, yeah, basing this thing on science is harder than just making it up and saying everything's fine. This is going to be really hard. We've got 85,000 Americans dead already. Finding our way out the other side of this is going to be hard and complex. We need people running things who are capable of understanding that and operating in that kind of an environment. I know it's too much to ask at the federal level, but it's what we need. New York Governor Andrew Cuomo joins us live next.